Hi all, good morning. This is Dr.Kalyani. Today I wanted to discuss about irregular periods. So many questions about irregular periods. Madam, is it so very important to get affected or disappointed or get emotionally drained out if I am not getting my periods regularly? So that depends upon the age. Okay, so menarche na enna? What is menarche? Menarche is nothing but when you are going to get your first periods. It depends upon the genetic constituency and your body mechanism and the hormones which you have and all the other things, the fast foods and the obesity, so many reasons. So early menarche, nowadays children are getting early menarche at the age of 10 years. Mothers will bring and tell me, madam, அஞ்சாவது தான் படிக்கிறா, by that time itself she has got periods, what to do? So it is so anxious mothers and anxiety children. So it is affected emotionally because mentally they are not matured enough to take what is periods, but physically they are matured enough to produce periods. That imbalance is very much in our days. It was only 13 to 14 years when we were attaining menarche. At that age we will be at 8th or 9th standard. Oralavukku we know what is periods and all, but nowadays kids 4th and 5th for a leave they are attaining 9.5 years, 10 years, 10.5 years, 11 years, like that, no? So early menarche, that may be due to the early mental maturity. Because of what? Because of the internet. அந்த காலத்தில் we don't even know what is sex, what is so many things we don't know. After coming to medical college only I came to know how normal childbirth will happen. So our ignorance is not there nowadays. The children are getting more matured because the world is in their hands, like internet, phone, with the accessibility. Whatever they want to see, wherever they want to visit, they can go with the phone inside their hands. So ulagam kaikulla vandiruchu, the world is in your hands. So the mental maturity, what all they are seeing, the brain is getting accustomed and accommodated to that fast growth of that this thing, and so many hormones are produced, and that may be the reason. Adu kuda they are not playing outside, only sedentary work. If at all they are playing also, only video games only they will be playing, nothing else, not going outside like us, playing on the streets, so many things. But nowadays children are enjoying with the video games, mobile phones, and study, that stress. So that may be the thing. But after menarche, if there is a irregular period, it is understandable. So mothers, don't panic, because she is matured enough with the body, but she is not matured enough with the brain. So brain la vandittu maturity of the pituitary, hypothalamo pituitary ovarian axis. ஹைப்போதலாமஸ்லேருந்து ஹார்மோன்ஸ் ப்ரொடியூஸ் ஆகி ஜேஎன்ஆர்ஹெச் அனலாக்ஸ் ப்ரொடியூஸ் ஆகி அப்புறம் இது வந்து பிட்யூட்ரியிலேருந்து அங்கேருந்து வந்து ஃபாலிகுலர் ஸ்டிமுலேட்டிங் ஹார்மோன், லியூட்டினைசிங் ஹார்மோன், அதோட ஸ்டிமுலேட்டிங் ஹார்மோன்ஸ் வந்து தென் இட் ஹேஸ் டு கம் டு த ஓவரியில் ஓசைட் ப்ரொடியூஸ் ஆகி ஈஸ்ட்ரஜன் ப்ரொஜெஸ்ட்ரான் வந்து தென் இட் ஹேஸ் டு கம் ஆஸ் அ பீரியட்ஸ். ஸோ மெனி திங்ஸ் ஆர். ஸோ மென்டல் ஃபிசிக்கல் மெச்சூரிட்டி வந்துருச்சு, பட் மென்டல் மெச்சூரிட்டி வரலை. ஸோ இட் வில் டேக் அட்லீஸ்ட் 2 years. So 2 years of irregular periods after attaining menarche, 10 years after, it is normal. So they are taking their own time for the mental maturity and physical maturity to get balanced. அதுக்காக that 2 years of irregular periods, but that irregular period should not produce the anemia in the babies. Like அந்த girls வராங்க, 4 மாதம் periods வரல, 4 months amenorrhea followed by a heavy flow of the history of bleeding clots, then you have to see the hemoglobin, and mother has to really take care of the child, how much she is bleeding, if she is looking pale or she is getting easy fatigability, திடீர்னு படுத்து சோர்வாக இருக்குமான்ட்டு she is becoming tired and sleeping, mother should take care, she is becoming anemic. Otherwise irregular periods after menarche till the age of 13-14 is normal if the periods is normal and acceptable. If it is prolonged periods with history of passing clots and girl is going to become anemic, definitely you have to come and consult to your gynecologist and see and get the treatment first. Second, irregular periods during the reproductive age group, that is 20 to 40 years reproductive age group, and the time irregular periods. Yesterday I talked about PCOS, how it gives irregular periods, yes, and how it is affecting the infertility, how obesity gives irregular periods, because all the fat, it is deposited on the ovaries everywhere, and it is becoming insulin resistant, so the diabetes as well as the irregular period starts. So for that also I gave the treatment, regularized hormone tablets with glycomet for the obesity and insulin resistance you can take with the doctor's advice. So irregular periods because of this thing, or they may get pregnant also if they are married, unmarried also. Nowadays premarital sex is becoming so very common, so I should not hide anything and talk. So irregular periods, first test your pregnancy. If you are pregnant, that may be the reason you have skipped your periods. If you are not pregnant, then do the ultrasonogram பண்ணிட்டு what might be the reason for irregular periods. There will be so many causes. Fibroids இருக்கலாம், fibroids will be there, adenomyosis will be there, endometriotic cyst, so many reasons. So one basic investigation of USG ultrasonogram pelvis is going to give out the diagnosis. With the